Robert F. Kennedy Jr. is running for president. He's promising big changes. One of his most talked about proposals? Cutting jobs at the Department of Health and Human Services, or HHS. Kennedy says HHS has become too cozy with Big Pharma. He believes they put profits over people. His solution? Slashing the agency's budget and workforce. Kennedy's supporters love his fighting spirit. They're tired of corporate greed, especially in healthcare. They see this proposal as a way to drain the swamp. Critics, however, are worried. They fear essential services could be on the chopping block. It's a bold move, but is it the right one? Kennedy's campaign is built on challenging the status quo. He's taking on powerful interests. The pharmaceutical industry is a major force in Washington. They spend millions on lobbying every year. Kennedy's willingness to take them on has resonated with voters who feel ignored by the political establishment. Kennedy believes HHS has lost its way. He argues that the agency is too focused on approving new drugs. He claims this is driven by the pharmaceutical industry's desire for profit. Kennedy points to the opioid epidemic as evidence. He blames HHS for not doing enough to stop it. He wants to see an HHS that prioritizes public health. He wants to see more focus on prevention and less on medication. He believes this will lead to a healthier population and lower healthcare costs. This message has struck a chord with many Americans who are struggling with the high cost of healthcare. Kennedy's critics argue that his views are too simplistic. They say that developing new drugs is essential for fighting disease. They also point out that HHS has taken steps to address the opioid epidemic. However, Kennedy's supporters believe that these efforts are too little, too late. One of the biggest criticisms of Kennedy's proposal is its lack of detail. He hasn't said which departments or programs he would cut. He hasn't specified how many jobs he would eliminate. This vagueness makes it difficult to assess the potential impact of his plan. Some worry that essential services could be affected. They point to programs like Medicare and Medicaid, which provide healthcare to millions of Americans. Others are concerned about the impact on research and development of new treatments. Without more specifics, it's impossible to know the full extent of the potential consequences. This lack of detail has also fueled criticism from Kennedy's opponents. They accuse him of making empty promises. They say he's more interested in scoring political points than offering serious solutions. Kennedy's supporters, however, argue that he's still in the early stages of his campaign. They expect him to release more detailed plans as the election draws closer. Even if Kennedy wins the presidency, enacting his proposed HHS cuts won't be easy. He'll face opposition from Congress. Many lawmakers receive campaign contributions from the pharmaceutical industry. These lawmakers are unlikely to support cuts that could harm the industry's profits. Kennedy will need to build a broad coalition of support. This will require convincing Americans that his plan will lead to a better healthcare system. It will also require standing up to powerful special interests. It's a daunting task, but one that Kennedy seems ready to take on. The outcome of this battle could have significant implications for the future of American healthcare. If Kennedy succeeds, it could usher in an era of greater government scrutiny of the pharmaceutical industry. It could also lead to a shift in focus towards preventative care. However, if he fails, it could embolden the industry and make it even harder to challenge its influence.